Democratic Visions is handmade in Eden Prairie and Minnetonka by DFL Senate District 42.
Our guest is Steve Kelley. Welcome, Steve.
Tim, thanks for having me here.
Steve is actively exploring a run for governor, 18 months out, I would add. I think Steve is well known to everybody that lives out in the 3rd Congressional District. Steve represented Hopkins, Golden Valley, and St. Louis Park in the Minnesota legislature from 1993 to 2006. Steve is presently the director of the Humphrey Institute for Science, Technology, and Public Policy. You know, we are in the midst of a budget crisis. $2.7 billion deficit for the next biennium, and the governor has chosen to unallot, to take it upon himself to make all the spending decisions and the cuts. Do you have an opinion about that, Steve?
I think the governor's sidestepping the whole legislative process in the way he has does go beyond the intent of the people who wrote Minnesota's Constitution. They gave the legislature the principal power for allocating funds. Now, the legislature wrote the unallotment statute and intended it to be for emergency use only. The emergency didn't exist at the end of the legislative session. It's the governor's own intransigence that created that emergency. So I don't know whether a court will have an opportunity to review what he did, but certainly the legislature ought to review the unallotment statute, and hopefully under a new governor will set up a different process so that this can't happen again.
I read someplace that the unallotment message that the governor delivered ran some 7 pages, 5 of which dealt with prospective cuts to health and human services. And what do you think?
Well, the main thing that the governor did that is wrong from a moral and a practical perspective is cutting 30,000 Minnesotans off their health care just because they're poor. That's a bad idea for, because we ought to have every Minnesotan having access to affordable and quality health care. But also because what will happen with low-income folks is that they won't seek care when they really need it, and then when they get really sick, will come to an emergency room and will get expensive care at the worst possible time. In the end, all of us will pay for that anyway. So it's another example of the governor claiming short-term savings and really increasing the costs in the long run. I do think we have to find ways to control the costs of health care, and there are a lot of great ideas that the legislature started and that the governor hasn't followed through on, that we can trim back some things in health care without cutting people off their health care completely. That's going to be an ongoing challenge, and I hope that if I get an opportunity as governor to work with the president and the Congress, that we get a national approach to health care reform and health care coverage that ensures that every American is covered, not just every Minnesotan.
Well, let's segue right into that. The Obama administration has in effect turned to Congress and said, come up with a plan that will extend coverage to uninsured citizens. And there have been any number of iterations as to how that might take place. Have you, in your own mind, decided which would be the best approach? For example, do you believe in having a public segment set up to compete with the insurance industry?
I appreciate the efforts the president has made to be flexible about this in an effort of actually getting something done. I do think that some kind of public plan as an option is really important. The president has made the point about competing with the private insurers, but I think just as important is the fact that it's time for us in the United States to disconnect health care from employment. Because if we're going to have the kind of dynamic economy we see coming, where people may change jobs multiple times, where people want to be able to start their own businesses, they ought not worry about losing their health care coverage if they make one of those changes or if they get laid off. We ought to make health care coverage independent from employment, and one of the advantages of some kind of public plan is that you could move in that direction. Now, if it's a national plan that's offered, that's fine, but I've heard that some of the other options are state-based plans or even these cooperatives, which may involve some state participation. If that's the case, I think the next governor of Minnesota ought to be working with the President and Congress to make sure that this health care reform and the effort to cover all Americans is successful, and if we have to play a role in that with some federal dollars, that would be fine.
Well, let's keep that in context. As indicated earlier, we've got a $2.7 billion deficit, and in the following biennium, I think the deficit is projected to be $4.3 billion. So if you were governor right now, or you're governor in 2010, how would you deal with those projected deficits?
Well, one of the things that I've learned over the 14 years that I was in the legislature is that especially when you're forecasting out 4 years ahead, the deficit projection is never right. So I don't think we want to worry about the exact number, but we do have to understand that Minnesota has a structural budget deficit, that our long-term commitments are running ahead of our long-term revenues.
That's what you mean by structural deficiencies?
Right. A structural shortfall is one that is repeated biennium after biennium and doesn't relate to the economy going up and down.
Okay.
And so I do think we're going to need some additional revenue. Jay Kudrowski, one of my colleagues at the Humphrey Institute, was a co-chair of a budget trends study commission that was established by the legislature and the governor, and they identified this structural budget deficit as a serious problem that had a couple components to it: a lack of sufficient revenues and out of control health care costs. Both of those things.
Excuse me, was there also some issue of the volatility of the revenues, where they might be high in one year and lower in another year?
In addition to there not being sufficient revenues, they raised the question that Minnesota's tax setup relies heavily on income taxes and sales taxes that respond very quickly to economic change. And they recommended somewhat more stable kinds of taxes. Now, we used to think that property taxes were pretty stable, but that's a relative term, because we've seen in this recent recession that even property values can change fairly dramatically and then affect government revenues. So we do have to think about stability at the same time that we think about other values like the progressivity of the tax system. Minnesota's tax system now is not as progressive as it should be, because wealthier families pay a smaller percentage of their income than middle-income families.
So would you be in favor of creating a fourth tier of income tax in the state for the upper-end wage earners?
I think we need to do something at the upper end to make sure that we've got at least a flat system, if not a more progressive system. But that by itself is probably not enough to close the structural budget deficit. We'll have to look at some other approaches to revenues so that we have a more balance. Because if you try to do it all with taxes on upper income families, that just adds to the volatility problem in the tax system.
Would you have an open mind to modifying the sales tax in some respect, either extending it or perhaps even increasing it?
Well, I think the better approach compared to increasing it is to broaden the base in a variety of ways. That would be my preference. But I think we ought to look at a range of options, depending on what the Congress does on cap and trade, for example. It might be appropriate for states to look at a carbon tax or something else that could supplement what the Congress is doing in providing incentives for people to move in the direction of more energy efficient vehicles and appliances, things like that.
I know you're a big proponent of education. What are your, just a soundbite here almost, to tell us what you think about some of the education issues that we should be focusing on?
I think the opportunity for Minnesota is to really work on closing the achievement gap by setting a goal that all of our children will graduate from high school ready to go on to college, and that they'll actually graduate from some college program, whether it's a one-year technical college or a 2-year community college or a 4-year program.
Well, what about tuition? Is that going to just run out of sight, or do you have any ideas in that regard?
Well, I think as we continue to explore ways to control costs in other parts of the budget, that we do have to step up again in terms of making sure that students can afford to go on to college. But one of our biggest challenges is making sure that we have enough students students graduating from high school ready to go as well. And I think that means early childhood education, making sure that kids come to kindergarten ready. It also means lining up the rest of our systems to support kids being successful.